Welcome, everyone, to meeting number 17 of the House of Commons Standing Committee on Health. The committee is meeting today to study the emergency situation facing Canadians in light of the second wave of the COVID-19 pandemic. I'm going to forego the usual housekeeping message as recommended by the committee. I agree that we don't really need it at this stage of the game. So I'd like to certainly welcome at this point the Honourable Patty Hajdu, Minister of Health, and the Honourable Anita Anand, Minister of Public Services and Procurement. Senior officials accompanying the ministers are from the Canadian Food Inspection Agency, Dr. Sarika Mitani, President. For the Canadian Institute of Health Research, Dr. Michael Strong, President, is scheduled, but he's not yet arrived. Hopefully he will come in as we proceed. With the Department of Health, we have Dr. Stephen Lucas, Deputy Minister. For the Department of Public Works and Government Services, we have Mr. Bill Matthews, Deputy Minister. And from the Public Health Agency of Canada, we have Mr. Ian Stewart, President, and Major General Danny Fortin, Vice President, Vaccine Rollout Task Force, Logistics and Operations. General Fortin also has not yet joined us, and hopefully he will join us as we proceed. And we have, of course, Dr. Theresa Tam, Chief Public Health Officer. So we'll go straight away into the minister's statements, starting, I believe, with Minister Hajdu. Minister, please go ahead, 10 minutes.
Well, thank you very much, Mr. Chair and honourable members. Je vous remercie.
I'd like to thank you for this opportunity to speak to you about the Government of Canada's COVID-19 vaccination strategy.
It's been just over 1 year since the first case of COVID-19 was detected in Canada, and the intervening months have been extremely challenging. Canadians have experienced hardship, anxiety, and heartbreaking losses. To say that it's been difficult is indeed an understatement. Cela fait un peu plus de...
It has been just over 1 year since the first case of COVID-19 was detected in Canada. The intervening months have been extremely challenging. Canadians have experienced hardship, anxiety, and heartbreaking losses. To say that it has been difficult would be an understatement.
Reason for hope. In less than a year, vaccines have been developed and authorized. Canadians are receiving them right now, and every single vaccination brings us closer to a safer, healthier, and more prosperous future. Mais aujourd'hui, il y a place à l'espoir.
But there is reason for hope. In less than a year, vaccines have been developed and authorized. Canadians are receiving them now, and every single vaccination brings us closer to a safer, healthier, and more prosperous future.
I'd like to begin by providing an update on vaccine distribution. As you know, both the Pfizer and the Moderna vaccines have been authorized for use in Canada and now are being distributed across the country. So far, we've secured a total of 80 million doses of these two vaccines. Of these, more than 1.1 million doses have been delivered to the provinces and territories, and this means that more than 860,000 people have received at least one dose of COVID-19 vaccine. Although the delays recently announced by Pfizer and Moderna will have a short-term impact on vaccine rollout, we are still on track to receive the full 6 million doses from Pfizer and Moderna by the end of the first quarter. Starting in April, the pace will accelerate, with at least 20 million doses delivered between April and June. And it's during this time that the mass vaccination campaigns will really begin to ramp up around the country. We are working with the provinces, territories, and Indigenous partners to prepare for this next phase. Most importantly, we expect to have enough vaccine for every Canadian by the end of September 2021, even if no other vaccine is authorized for use in Canada. D'ici là, bien que l'approvisionnement soit...
In the meantime, while supplies are limited, vaccines are being distributed strategically to the groups who need them the most.
territories are responsible for the distribution of vaccines within their jurisdictions, their decision-making is informed by the recommendations of the National Advisory Committee on Immunization. Last fall, the committee recommended who should be vaccinated first, given limited initial supplies of vaccines. And this includes residents and staff of congregate living settings that provide care for seniors, adults 70 years of age or older, starting with those 80 years of age and over, healthcare workers, and adults in Indigenous communities where infection can have disproportionate consequences. Given these guidelines, I'm pleased to say that there's already been notable progress in the territories. In Nunavut, more than 11% of the population has received at least one dose of Moderna. In the Northwest Territories and the Yukon, more than 21% and 9% of their respective populations have received at least one dose of the vaccine. This month, the National Advisory Committee will be updating its guidance on the prioritization of initial doses of the COVID-19 vaccine. And this updated guidance will help inform stages 2 and 3 of the vaccine rollout as vaccine supplies increase. In the meantime, we expect additional vaccines to be authorized. Health Canada is now reviewing vaccine submissions from AstraZeneca, Janssen, Verity Pharmaceuticals, and Novavax. Should these vaccines be found to meet Health Canada's strict standards for safety, efficacy, and quality, they would be authorized and included in upcoming vaccination campaigns. Vaccine development is a long and highly complex process. In normal times, it can take years to carry out the extensive research needed to produce a safe and effective product. Vaccine reviews normally take place after all clinical studies are completed and the full results are available. But of course, these are in normal times, and we're fighting a global pandemic and many thousands of human lives hang in the balance. And with this in mind, we put into place measures to safely expedite vaccine authorization. Health Canada is the regulator responsible for this process. We recognize the need for flexibility to expedite it given the urgency of the COVID-19 pandemic, but we can't compromise on safety, quality, and efficacy. That's why last fall I signed the interim order respecting the importation, sale, and advertising of drugs for use in relation to COVID-19. And this interim order allows us to accept rolling submissions for COVID-19 drugs and vaccines. What that means is that manufacturers can submit data as it becomes available. These requirements are comparable to those established by other major regulators such as the US Food and Drug Administration, the European Medicines Agency, and the World Health Organization. It was through this expedited process that the Pfizer and Moderna vaccines were authorized. Health Canada is using the same process to review subsequent submissions for COVID-19 vaccines. Once an authorized vaccine is in use, Canada continues to monitor its safety through its well-established post-market surveillance system. This system collects safety data from various domestic and international sources, including mandatory reporting by manufacturers, which allows Health Canada and public health authorities to respond quickly to changing trends or unusual adverse events. This system was enhanced through the interim order, which provides the authority to impose terms and conditions or any authorization or establishment license on any authorization or establishment license at any time. This includes a post-market safety and effectiveness system with risk mitigation measures and additional assessments of safety information as requested by Health Canada. And of course, Health Canada will not hesitate to take action if safety concerns are identified. The Government of Canada is working closely with provinces, territories, Indigenous, and public health partners to ensure the timely rollout of the vaccines as they're authorized by Health Canada. And our vaccine strategy is being led by the National Operations Centre. This centre was created by the Public Health Agency of Canada and is supported by the Canadian Armed Forces and the Department of National Defence. At the same time, the National Emergency Strategic Stockpile of the Public Health Agency is making sure we have the supplies we need for a smooth rollout. And this includes millions of needles, syringes, and alcohol swabs, as well as freezers for vaccine storage all across the country. Avec la vaccination en cours et les mesures mises.
With vaccination now underway and measures in place to ensure a reliable supply of vaccines, we can look ahead to a future free of COVID-19.
Everything it can to reach that future as soon as possible. We're taking steps to authorize safe and effective vaccines quickly. We're protecting our most vulnerable citizens first, and we're working with all partners to ensure that everyone who wants a vaccine can get access to a vaccine. Par ailleurs, Le gouvernement du Canada continue.
At the same time, the Government of Canada continues to invest in research. The Canadian Institutes of Health Research is addressing many issues related to COVID-19, from the development of vaccines and therapeuticals to the variants of the virus, including their impact on the effectiveness of vaccines.
We must continue what we've been doing. Staying physically distant, washing our hands, wearing a mask. Nous le devons à nos aînés.
We owe it to our seniors. We owe it to our neighbours with high-risk conditions. And we owe it to our healthcare providers and essential workers.
We must stay vigilant as we wait for our turn to get vaccinated, and that day is coming soon. When it does, I want Canadians to be proud of how they've worked together to overcome this unprecedented health crisis. Thank you.
Thank you, Minister. I'd like to acknowledge and welcome Dr. Strong and Major General Fortin, who have now been able to join us. Welcome, gentlemen. We'll go now to a statement from Minister Anand. Minister, please go ahead. 10 minutes, please.
Merci beaucoup et bon.
Thank you very much. Hello, everyone.
Opportunity to appear before this committee alongside my colleague and Minister of Health, the Honourable Patty Hajdu. I would like to acknowledge that I am meeting you from the territory of many First Nations, including the Mississaugas of the Credit, the Anishinaabe, the Chippewa, the Haudenosaunee, and the Wendat peoples. Joining me today is my Deputy Minister, Mr. Bill Matthews. Je tiens tout d'abord à remercier les.
Before I begin, I'd like also to extend a thank you to all of the people working behind the scenes who continue to make these virtual meetings possible, particularly our interpreters and translators who play an essential role in ensuring Canadians have the most pertinent information in this time of crisis. Globally, we have been living with COVID-19 for over a year now. From the beginning, my department, Public Services and Procurement Canada, has worked tirelessly to procure the necessary supplies needed to get Canada through this crisis.
More than 2.5 billion individual items of personal protective equipment. And we have delivered tens of millions of COVID tests, supplies, and therapeutics, including 19 million rapid tests to our provincial and territorial counterparts. We know that the fastest way out of this pandemic is by getting vaccines to Canadians as quickly as possible. This is why we signed a number of agreements for more doses than we would need as early as last July last year. Our efforts were guided by, first, the Vaccine Task Force, and second, the Public Health Agency of Canada. Our procurements proceeded after we received that advice. Our goal from early on was to build up a diverse portfolio of vaccines so that Canada would be ready once they were authorized and indeed discovered. As a result, we now have doses of authorized vaccines under contract to be delivered this year, enough to inoculate every single eligible Canadian. Comme le ministre Hajdu l'a fait remarquer,
as Minister Hajdu has noted, vaccines are now arriving and more are on their way. Yet, while we are making significant progress, we have also known that there could be some bumps along the way. And we have always been upfront with Canadians about that fact.
And effective, vaccine manufacturers are significantly ramping up production to fill orders from around the world. Given this unprecedented reality, it is not surprising that vaccine supply chains have been volatile. The whole world is operating in this environment, and all countries are facing the same challenges. This is precisely why we took the approach of putting in place a number of agreements and building up a diverse portfolio with flexibility built into our contracts. When Pfizer and Moderna informed Canada and other countries that deliveries would be lower than predicted in the short term, it was disappointing news. I want to assure members and all Canadians that these delays are only temporary. I can tell you that I and my officials have been in touch with suppliers every day to ensure that they meet their contractual obligations, and deliveries to Canada did resume this week. Last Friday, a shipment left from Europe with Pfizer vaccines. This Wednesday, a shipment left from Moderna with vaccines, and both have arrived in Canada for distribution to the provinces and territories this week. In addition, through the COVAX initiative, Canada will also receive approximately 1.9 million doses of the AstraZeneca vaccine. This will be in addition to the 6 million doses of Moderna and Pfizer that arrive this quarter. Mr. Chair, the AstraZeneca deliveries are, of course, dependent upon Health Canada approval. And these deliveries are in addition to the 20 million doses of AstraZeneca that Canada has secured through an advance purchase agreement directly with AstraZeneca. I can assure this committee that I work closely with all vaccine suppliers to accelerate their delivery timelines into Canada. We continue to work closely, especially with the 4 other manufacturers with whom we also have bilateral agreements: Sanofi, GSK, Medicago, J&J, and Novavax. Our diversification strategy is working. We have 2 approved vaccine candidates, 3 in regulatory approval, and 2 in clinical trials. Once regulatory authorization is given, we will take action to get more vaccines into Canada as soon as possible. We need to remember that we are in the early stages of a massive undertaking. As supply chains stabilize, we will see more predictable and more significant progress. With the action taken so far, by the end of September, every eligible Canadian who wishes to have a vaccine will be able to have one. And I can tell you that we are continuing to press our suppliers to make sure that we get advanced deliveries for doses even earlier, and no stone is being left unturned. Bien que les vaccins soient d'une importance capitale,
While vaccines are critically important, my department has also worked hard to secure syringes needed to administer vaccinations. We have secured over 170 million syringes of varying sizes from a range of suppliers. This includes 64 million of the low dead volume syringes, which are an extremely limited supply around the world.
Approximately 1 million of those specialized syringes is arriving in Canada this week, with another million on the way for next week, and deliveries continuing through to May. Mr. Chair, there is no greater priority than protecting Canadians from COVID-19. We are fighting every day to get PPE, rapid tests, and vaccines for Canadians, and this is what we will continue to do. I am committed to this effort. I look forward to working with this committee and my parliamentary colleagues to put this pandemic behind us once and for all. Together we will get through this, and I appreciate being here with you today, and I look forward to taking your questions. Thank you so much. Merci beaucoup, Miigwech.
Thank you, Minister. I should advise everyone that when people switch from one language to another, there seems to be a bit of a gap in the translation. So I would encourage people who are going to switch from one language to another to maybe insert a bit of a pause between one language and the next, so we can allow the sound system to catch up. Anyway, thank you, ministers, for your statements. We go now to our rounds of questions. I expect that we'll be able to get in 3 rounds of questions. We'll start with Ms. Rempel-Garner, please, 6 minutes.
Thank you, Chair. Today, the Prime Minister said 20 million doses of AstraZeneca would arrive by June, but then officials from Public Works said that the timeline was wrong. Can the Minister clarify by what date Canada will receive 20 million doses of the AstraZeneca vaccine?
Thank you so much for the question. And I refer back to our contracts for these doses, and we have deliveries of AstraZeneca arriving in Q2 and Q3 at
So
the current
answer is you
time.
can't. Thank you. Does Canada's contract for the AstraZeneca vaccine require the drug maker to only use best reasonable efforts to supply Canada with doses, or did the government negotiate a firm guarantee of doses on a set timetable delivery basis? That is a guarantee beyond so-called reasonable efforts.
Well, thanks again for the question. We are expecting doses of AstraZeneca, as I said, in Q2 and Q3, and we are in conversations with AstraZeneca every day to ensure that those doses come into this country as soon as possible.
Does the AstraZeneca contract
in our contracts? Thank you.
Does the AstraZeneca contract guarantee delivery beyond best reasonable efforts?
My understanding from my discussions with AstraZeneca, as well as reading the contract, is that those deliveries will be arriving in Q2 and Q3, and that is the promise that we have under contract. Thank you.
Did the government negotiate guaranteed precise delivery timeline of vaccine doses with any manufacturer? That is a guarantee beyond so-called reasonable efforts, and if so, which manufacturer?
Again, thank you for the question. All of our contracts have quarterly delivery schedules, and the weekly delivery schedules that the provinces and territories are seeing are estimated delivery timelines that the companies are providing to the Public Health Agency of Canada directly.
To the Minister of Health, given recent shortfall fluctuations, has the government asked the provinces to plan for potential logistical issues in terms of mass end-of-quarter delivery or distribution, as opposed to monthly or more frequent allotments, including spoilage issue due to freezer and movement capacity?
Thank you very much for the question. The government is, through the National Operations Center, working on a day-by-day basis with provinces and territories to support them in delivering vaccines as they arrive.
Have any of the provinces expressed to the government challenges that they might face by end of quarter as opposed to monthly or more frequent delivery basis?
Provinces and territories have expressed a number of challenges that they might face, and the federal government is supporting them to address those challenges. I'll turn to Major General Denny Fortin to speak a little bit more about the ongoing relationship.
That's good. Thank you. I was just looking for a yes or no. A Globe and Mail report today stated that the government only expected the Pfizer and Moderna vaccines to be approved in April, which contributed to our current shortage. Can the minister tell us when she assumes, for rollout purposes, AstraZeneca, Johnson & Johnson, Novavax, and Medicago to be approved by Health Canada, given that they assumed April for Pfizer and Moderna?
Through the chair to the member, the regulatory process is independent, as she knows.
Again, they did make an assumption of April. That's why I was asking the question. What date are we anticipating the first arrival of vaccines from the COVAX program? The Honourable Minister is on mute.
Sorry about that. Thus far, we have not been given a delivery date from the COVAX facility. They have indicated that just about 500,000 doses could arrive in Q1. We are still in discussions with them to firm up that timeline. Of course, it's dependent upon regulatory approval in Canada and WHO approval. Thank you.
So does the government anticipate we will have approved the AstraZeneca vaccine prior to receiving the shipment of this vaccine from COVAX, or will we have taken doses from poorer nations that we aren't allowed to administer to our own citizens?
So to be clear, we're not taking doses from poorer nations. The way the COVAX facility is set up is that we have donated 220 million twice, once for the developing countries and once for Canada to have access. Thank you.
The government negotiated quarterly, not weekly delivery quotas. France, the United States, and the UK health authorities have issued concerns with extending the dosing window due to potential efficacy delays. Has the government prepared guidelines for the provinces on how best to administer doses given potentially quarterly supply disruptions?
The dosing schedules have been provided through the regulatory approval process.
Has the minister updated those guidelines given potential quarterly supply disruptions?
I will turn to Dr. Tam for the work that she's doing through NACI. There has been a review of the dosing schedules.
There's a National Advisory Committee on Immunization based on the data available.
Just for time's sake, could you table that with committee? The updated schedule? Thank you.
It is published.
Other countries have decided not to administer AstraZeneca vaccine to people aged 65 and older due to efficacy concerns. Does the government anticipate that the AstraZeneca vaccine, if approved, will be administered to Canadians aged 65 and older? The minister is on mute.
The AstraZeneca vaccine is still under review by the regulators.
Does the minister anticipate that it will be delivered to age 65 and older?
Thank you, Ms. Rempel Garner. We go now to Mr. Kellaway. Mr. Kellaway, please go ahead, 6 minutes.
Thank you, Mr. Chair. And my questions for this round will be directed to Minister Anand. Thank you, Minister, for being here today and for your hard work and your department's hard work that you've done over the past year. I think PSPC has been steadfast in their commitment to ensuring that Canadians have the best access to tools when it comes to fighting the virus like PPE and vaccines. But here's a concern of mine. Canadians across the country are hearing so many different stories about Canada's position in the world with respect to vaccines. So 2 questions for you. Can you tell us how we are faring? And does this have any effect on how you negotiate with vaccine companies? Thank you.
Well, thank you for the question. I just want to correct the record in terms of the previous question of the honourable member with regards to the Globe and Mail article that she referenced. Any assertions that we weren't expecting doses in the first quarter is categorically false. From the beginning, our contract stipulated first quarter deliveries as they are now occurring. In July and the beginning of August, we signed contracts for deliveries to begin in the first quarter. That is exactly what is happening now with doses arriving in Canada, including early deliveries of both approved vaccines in December. That is why we can say with confidence that our vaccine procurements remain on track for 4 million Pfizer and 2 million Moderna by the end of March, and vaccines for all Canadians by the end of September, despite these temporary but not entirely unexpected delays. We will continue to provide Canadians with accurate and clear information based on the contracts and discussion we have with the manufacturers as soon as we have it. Now to the question from the honourable member, I will say that at the outset, we signed very early with Pfizer and Moderna in order to be out in front of all countries. We were one of the first countries to sign with Moderna. We were the 4th country to sign with Pfizer. That is why we were able to have one of the earliest access to those vaccines at the beginning of December. And that is why they came forward and quickly sold options to us for 20 million more of each of those candidates, so that we have now 80 million doses of approved vaccines in this country to ensure inoculation of all Canadians prior to the end of September. But in addition to that, I would like to mention to the honourable member in this committee that we are working with these approved manufacturers to move up their delivery timelines, so move doses from Q3 into Q2, so that we can potentially see additionally accelerated timelines. If additional vaccines are approved, we can expect also to see doses in Q2 and Q3 of those additional vaccine candidates. And so again, the end of September is the outside timeframe that we are providing based on approved vaccines, and we may indeed see that timeline shifting up over the course of the next weeks and months. Thank you.
Thank you, Minister, and thank you for that reality check. I believe we were the first or one of the first countries to negotiate a contract with Pfizer and Moderna. Number one, is that true? And can you speak at all about the relationship we have with these companies and how we've developed that?
Well, thank you again. Well, by all means, yes, that is true. We were one of the first countries to sign with these corporations. And I will say it's because of the very hard work of our public servants and the fortitude and heft that the Government of Canada brought to the negotiating table each and every day during the month of August and September when we were concluding these agreements. Signing 7 contracts with leading vaccine manufacturers is no small feat. This allowed us to have about 400 million doses, enough vaccines to inoculate Canadians 10 times over. And it was also in addition to the vast PPE procurements that these same public servants had accomplished for Canada, as well as over 40 million rapid tests procured. So we have been working around the clock, Mr. Chair, in order to ensure that Canadians have the supplies they need. And in addition to those procurements, we have put in place an end-to-end logistics system, purchase deep freeze and ultra deep freeze storage, purchase gauze, syringes, alcohol swabs, sharps containers, deliver these to the provinces and territories so that we can support the provinces and territories in a very collaborative and a cooperative manner so that all Canadians are supported through to the end of this crisis. Thank you, Mr. Speaker.
Mr. Chair, how much time do I have left?
You have 45 seconds.
Okay. Anything to add, Minister Hajdu, to Minister Anand's questions or any insights on the topic at hand?
Well, thank you very much to the MP, and I just want to thank Minister Anand and her team for working so closely with Health Canada. In fact, we've worked extremely closely over the last several months, and in particular around the time of the approval of Pfizer and Moderna, where we had regular and ongoing communications both on the political side, but also through our departments to make sure that the approvals were indeed aligned with the procurement plans and schedule. I want to also thank Health Canada for the incredible speed in which the regulators worked. This was done by additional resources invested in Health Canada regulatory teams, but also through the dedication of these teams who worked literally 24 hours a day, 7 days a week to review the ongoing submission of data from both companies. So Canada was indeed one of the first countries to approve both vaccines, and we were very lucky to get early doses, which allowed for the provinces and territories, quite frankly, to get used to working with these unconventional vaccines that required, as we all know now, different ways to store and transport. And that work that was done through Major General Danny Fortin with the provinces has stood us well for the future shipments that are coming.
Thank you, Minister. Thank you, Mr. Kellaway. Nous allons maintenant à
Mr. Thériault, the floor is now yours. 6 minutes, please, sir. Thank you very much, Mr. Chair, and I'd like to welcome Ministers Hajdu and Minister Anand and to all officials here today. My remarks will focus on transparency, lucidity, predictability, and credibility. And this afternoon, we're going to try and be somewhat apolitical and useful in our politics. Now, with the doses that you've announced, you haven't, in fact, shed any light on this. It's, in fact, fireworks of false hopes that have been set off. And since the 28th of January, you've replaced those quote-unquote fireworks by a candle with a flame which is gradually going out. So at the same time, we need to give Canadians and Quebecers hopes. But that hope comes through predictability, through being clear and not opaque, through being transparent. In the midst of a crisis, you need to keep Canadians adhering to public health measures. You need to keep them committed. Frontline healthcare workers need to know what's going on. Vulnerable people need to see light at the end of the tunnel. Why is it that you are so lacking in transparency when it comes to the delivery schedule? Why not present a new credible rollout schedule? Why not make public the procurement of vaccines, especially when it comes to deliveries?
Well, maybe I can start.
Mr. Chair, if I could just take a second, I'd like you to stop the stopwatch. Unfortunately, there's a little bit of a lag between my question and the response. That's going to happen a lot with the lag from interpretation. So I don't want to waste or lose all of that time because of lag in interpretation. I don't think that's fair. So I do hope that you factor that in. Will you do that, Mr. Chair, when there is a slight lag after my question?
Merci, Monsieur Thériault.
Thank you, Mr. Thériault. Yes, I'll do my best in that regard. Thank you, Mr. Chair. Sorry, Minister, please go ahead.
Okay, well, thank you very much, MP Thériault. And I will just say this, we have been completely transparent with provinces and territories. We've shared the good news with them. We've shared the bad news with them when doses are delayed. And we've certainly shared with them our anticipated delivery schedules to the degree that we know them. And I will ask Danny Fortin to speak a few words about that, because his work has been exemplary in this area of complete transparency with provinces.
Excusez-moi, Madame la Ministre.
Sorry, Minister, to cut you off. Sorry, Minister. But right now, every expert is saying that your schedule of 6 million for the 31st of March is impossible to meet. And Calvez said only yesterday that it is absolutely unrealistic. It's impossible to meet the late September timeline unless there's a miracle. So why not present a new delivery timeline for vaccinations? Given that the vaccinations just aren't showing up, the vaccines rather, why such a lack of transparency?
I will just reiterate, MP Thériault, that in fact we have been transparent with Canadians, sharing good news and sharing disappointing news. As you know, when we found out that there would be a delay in deliveries, we shared that information with provinces and territories openly, and we'll continue to do that every step of the way. I will turn to General Danny Fortin if he has a moment to speak a little bit about the conversations he has on an ongoing daily basis with provinces and territories, including Quebec, so that they can be anticipating what they might expect to get.
Je sais très bien.
Well, I know full well that Major Fortin is doing the best he can with what's at his disposal. But right now, the vaccines haven't been rolled out. So right now, I'm asking you the question. I'd like to hear your answers. And when I decide to ask Major Fortin questions, I will. You say that you weren't lacking in transparency, but your approach has been opaque. No one believes otherwise. How would there be herd immunity by late September? How is it that all these vaccines will be rolled out by late September? Why are you going headlong into that blinkered thinking when the fact of the matter is the government needs to take well-informed decisions when it comes to public health measures, and you're not doing that? That's where we're at right now. This is a marathon, Madam Minister. And in a marathon, you need to know the stages of the marathon and when the marathon will end. No one in their right mind believes in the maths that you are telling us.
Well, thank you, MP Thériault. And I don't know if you've ever run a marathon, but I have. And part of running a marathon is actually planning, setting goals and milestones, and preparing, practicing, doing rehearsals, tabletop exercises in this case, making sure provinces and territories have the equipment that they need, that they have the plans that they need. You're absolutely right. This is a marathon. This is also a very big lift, and we are doing that in partnership with provinces and territories.
Oui, pour votre gouvernement.
Well, for your edification, I've actually done triathlons myself, Madam Minister. But here's what I'd like to tell you. Currently, in terms of supply, we don't know either what the costings are or what the delivery schedules are. When I hear Minister Anand say that each and every day she has to pick up the phone and speak with the providers, then there's something that's not clear in the contracts. Why would you have to pick up the phone and speak to providers each and every day to make sure they're keeping their promises? Why not make those contracts public? What are you trying to hide? Are you trying to protect the pharmaceutical companies, the government, or Canadians?
Thank you. I will just step in here to say that each and every one of our contracts has a confidentiality clause in it, and I or the Government of Canada cannot simply release contracts, or we will be in breach of contract, and our vaccine procurements and deliveries will...
Why negotiate on a quarterly basis then?
Thériault.
Mr. Thériault, why negotiate on a quarterly basis, says Mr. Thériault, the chair, when it's important to vaccinate people on a daily basis?
Monsieur Thériault,
Mr. Thériault, your time has run out.
Merci.
Merci, Monsieur Thériault.
Thank you, Mr. Thériault.
I would like to suggest to all members that the officials are here to assist the ministers in their responses, and I would encourage you all to give them an opportunity to do so. We go now to Mr. Davies. Mr. Davies, please go ahead. 6 minutes.
Thank you, Mr. Chair. Well, for the record, I can barely run around the block. I'd like to direct my questions to Major General Fortin, if I could. Yesterday, General, you confirmed that the federal government doesn't know how many Moderna doses will arrive for the rest of this month or throughout March, and that Moderna hasn't said why it has reduced shipments to Canada. Despite these unknowns, you said Canada is still expecting 2 million Moderna doses to be delivered by the end of March to meet the Prime Minister's promised vaccination targets. My question is this: given the company hasn't provided Canada with a delivery schedule for the period or any explanation for the delay, what is the basis of your confidence? Is it mere hope? I'm sorry, I can't hear you, General.
General, your headset on the line to it has a switch on it. Maybe check that to make sure it's on. Mr. Davies, I'll give you a few extra seconds here for this.
Thank you. Well, it's by my clock, it's approaching about 20 seconds at this point.
Well, I've stopped my clock here, so.
Thank you, Mr. Chair.
Mr. Chair, can you hear me now?
Yes, thank you, General.
My apologies, Mr. Chair. We had some technical challenges early on and I couldn't do a test.
Very well.
Mr. Chair, thank you for the question. Let me just say Moderna and Pfizer certainly face global demands in a very demanding production of a new product. We have no reasons to doubt that they are both ensuring that there's a fair and equitable sharing of doses in these times of uncertainties. We always said we would have limited supplies, and certainly seeing that. I see this as a bump on the road for sure. I have no way of confirming, we have no way of confirming if it's a true statement that they have real difficulties with Moderna supplies. But in our conversations, we have clear indications, we have numbers to see a positive trend coming out of this current lack of supplies.
Thank you, Major General. Yesterday, you also acknowledged that the uncertainty created by Canada's sporadic vaccine deliveries is creating challenges for the provinces and territories. You said, I completely understand that it's making it more difficult for provinces to prepare clinics and prepare the vaccine distribution sites. Now, it's quite clear that if the government projections and current are correct, that millions of doses will be arriving at around the same time, probably mid to late March. Now, the Biden administration recently announced plans to enlist the support of FEMA and the National Guard to set up thousands of community vaccination sites to help ramp up COVID-19 vaccine administration in the US. And the Pentagon has been asked to ready up to 10,000 troops for that campaign. Is the Government of Canada considering establishing federal vaccination sites or deploying the Canadian military to help provinces and territories with the volume of doses that are obviously coming?
Mr. Chair, I cannot speak to our current Canadian Armed Forces and Department of National Defense planning in that regards in great detail. This is the purview of the Chief Defense Staff, who would be asked to provide advice to the Minister in that regards. What I can tell you is that we're working closely with provinces and territories to ensure the most effective clarity on supplies, most effective rollout, and work closely with them in their jurisdiction to do as effective a rollout as possible.
Well, General, can you tell us in the most general terms, if there's you're hearing anything about possibility of federal support to set up vaccination sites to supplement the provinces who may have difficulty handling those millions of doses? Are you hearing anything at all in that regard?
Mr. Chair, what I can tell you is that Canadian Armed Forces are providing assistance to provinces and territories in their planning, working with the Red Cross, with ISC in their planning as well. try to figure out different ways of doing things and ensuring that we provide capacity and as a result of RFAs as we see in Northern Ontario at this time.
Thank you, General. Dr. Tam, on January 30th, you noted that even though daily cases of COVID-19 are trending down, it's still too soon to lift lockdowns and ease other protective measures if Canada hopes to bring the pandemic under control. You pointed to the spread of several highly transmissible variants of the virus as evidence that it's too soon for the provinces to let their guards down. However, this week, Alberta, Quebec, and Ontario all announced plans to ease COVID-19 restrictions, and Manitoba is also considering that. As Canada's Chief Public Health Officer, do you believe that the federal government should implement minimum national standards for COVID-19 control to prevent highly transmissible variants from becoming established in provinces with insufficient control measures and then spreading interprovincially?
Right, as I've said, that we need to navigate this phase of our pandemic response really carefully, and I work very closely with the Chief Medical Officer of Health. They all have very different contexts upon which they work. We do provide guidance on a range of public health measures and laboratory testing and other guidance as well. But as you can appreciate, PEI is not the same as Edmonton, and so they do have to take things into account. But I think that they know that with the variants and increased transmission, they have to do any easing really, really carefully. So that is their perspective.
Thank you. Ms. Anand, we have to quit meeting like this. We spent time yesterday. Yesterday at Industry, you testified that Canada's vaccine contracts have confidentiality clauses that prohibit the release of any terms. You've repeated that today. But your government has disclosed both the number of doses in the Pfizer and Moderna deliveries, as well as the delivery schedules. Can you explain how those disclosures are not violations of the confidentiality agreement?
Am I able to respond, or?
Yes, please go ahead. Very quickly, if you could.
I'll try. Yes, nice to see you, Mr. Davies. I just wanted to mention that the delivery schedules are outside of the contract per se. The contract per se has included in it quarterly timetables for deliveries. So in aggregate, the number of doses that Canada is entitled to on a quarterly basis. And the delivery schedules are provided outside of the contract, and they are estimations that the company provides directly to the Public Health Agency of Canada. And on my understanding, the Public Health Agency of Canada makes those public to the provinces and territories for the purposes of planning. Thank you.
Thank you, Mr. Davies. I gave you a little extra time because of the problems earlier on. So,
thank you, Mr. Chair.
We go now. Sorry, that ends the first round of questions. We will start our second round of questions with Monsieur Paulus. Monsieur Paulus, allez-y.
Mr. Paulus, the floor is yours. 6 minutes. Thank you, Mr. Chair. Minister.
Minutes.
5 minutes, Mr. Paulus. Yes, you just said, Minister, that in your contracts, there's no penalty clause regarding late deliveries. So if we've understood correctly, the companies have from the 1st of January to the 31st of March, and we could receive the vaccines in bulk on the 31st of March, and we have no recourse whatsoever at our disposal. Yes or no?
Thank you for the question. The recourse, of course, is breach of contract. And what we are working with in terms of our negotiations with the companies is to ensure that we do have ascertained delivery schedules. Thank you.
So you said there should be a time frame, and so therefore, is there some kind of clause whereby they have to give forward notice? Because Pfizer at the 11th hour said that they'd be cutting off deliveries. Is there such a clause?
The contracts, as I mentioned, are subject to confidentiality, and therefore it would be imprudent, if not illegal, for me to go into detail about what those clauses say. However, as I mentioned to Mr. Davies, we do have the negotiated delivery schedules, which we are providing to the provinces and territories as soon as we get them.
Parlons de secret, Madame.
Let's talk about secrets, Minister. I have AstraZeneca's contract here with the European Union. I have Pfizer's contract here with Israel, and AstraZeneca's contract with the US. Now, in the AstraZeneca contract with the European Union, it states clearly that vaccination delivery occurs on a monthly basis. Now, how is it that I got my hands on these major contracts and yet Canada, we can't put a finger on any information? Do you find it normal that the health minister of Quebec is complaining in media outlets that they can't get any information on contracts that have been signed by the federal government? Is that normal?
I would very much like to respond to this question. Firstly, by saying that the release of the AstraZeneca contract by the European Union occurred after a negotiation, and AstraZeneca itself agreed to the release of that contract. Furthermore, I would like to say that the redactions are so intense in that AstraZeneca contract that there are no delivery schedules included. That's quite unlike the transparency that the Government of Canada is providing. In fact, we do provide our delivery schedules, good and bad, so that the provinces and territories can plan. Do you understand the point that it's been negotiated that that contract can be released? And I and the government do not wish to breach our confidentiality obligations under contract. We all want vaccines as soon as possible, and I'm not going to do anything to jeopardize that.
If
AstraZeneca agreed to release its contract, and it is true that some sections have been blacked out, but it clearly states that there's monthly rollout. And yet in Canada, everything we have is on a quarterly basis, and it's very difficult to make plans in light of that. Do we have in the AstraZeneca contract a same clause for monthly deliveries, yes or no, for upcoming deliveries?
As I said, I am under confidentiality provisions regarding those contracts, as is the Government of Canada. But I will say AstraZeneca has not even been approved in this country, and we are making sure that we accelerate deliveries on a quarterly basis for that vaccine and all others once regulatory approval occurs. I would sincerely and respectfully ask that you do not put words in my mouth. I am providing facts to the Canadian public as I see them and read them in our contracts, and I want to be clear with Canadians that we do not provide them with misinformation. Thank you.
I'd like to believe you, Minister, and I know you're doing your best, but all we have at our disposal, the media, us, is that Canada seems to be doing very poorly when it comes to negotiating contracts, and we don't know when, as Canadians and Quebecers, we're going to be vaccinated. I don't think my time's run out, Mr. Chair.
Well, I hope I'll be able to respond to that. Actually, we have 1.4 million vaccines in this country. We have vaccines arriving this week, Friday, Wednesday, and again this weekend we are going to have shipments coming into Canada. And the most important thing is that the temporary reduction that we saw last week is not going to continue. We are going to see a continual ramp up of vaccines arriving in this country in Q1 and a very steep incline in Q2. And I would like to suggest to the provinces and territories especially that that ramp up is something we are talking about and telling you about now. And we would very much like to work with you and provide supplies, etc., in order that the planning for that mass vaccination campaign can begin in earnest. That's our commitment to Canadians. Thank you.
Merci, Monsieur.
Thank you, Mr. Paulus.
To Mr. Van Bynen. Mr. Van Bynen, please go ahead. 5 minutes.
Thank you, Mr. Chair. My questions are for Minister Anand. But before asking my question, I will say to you that I will allow you to answer your questions, not because of Standing Order 16.2 or Standing Order 48.2 or Standing Order 18 or Standing Order 11, but out of respect and courtesy for your professional advice that you're providing this group. I also want to put an end to some of this armchair contract speculation. As a banker of over 30 years, I believe that transparency in your business dealings is extremely important, but so is respecting confidentiality, particularly when it comes to intellectual property and commercial contracts. Whether in the House or in committees, the opposition keeps asking for details of the vaccine contracts to be released. Minister, we all have a common goal to get Canadians vaccinated through this pandemic, and would releasing a contract improve the availability of Canadians to access to this vaccine any sooner?
Well, thank you for your statement at the outset. And I will say, I too believe in the utmost professionalism when testifying at committee or appearing in the House of Commons. It's one of the reasons I entered politics, to ensure that we have proper discourse. I will say that the release of contracts is something that I can understand Canadians and the opposition wanting, given that I too believe in transparency and accountability. I have been raising this issue with the vaccine suppliers. At the same time, we are obliged to respect the terms of our contracts. There are two parties to a contract. It's a bilateral deal. And as a result, I cannot unilaterally decide to release a contract. It needs to be something that both parties agree upon. And as a result, at this point in time, it would be imprudent and illegal for me to release those contracts. Now, to the point of your question, that is, would it provide greater clarity? As I said, those vaccine contracts contain quarterly delivery timelines, which we have mentioned are the end of March for Pfizer and Moderna for 4 million and 2 million doses, respectively. The part of this negotiation with the vaccine suppliers that we are making clear are these estimated delivery schedules that naturally shift given the ramp up that is occurring in the supply chain at their production facilities. We will continue to provide information to Canadians, whether it is positive or negative. Unfortunately, last week involved negative news, but we still provided it. This week, we are seeing a ramp up in the deliveries coming to Canada, and that is going to continue to steadily incline. And that is information that we will also share with Canadians in the interest of transparency and accountability. And then to go back to the point about what else are we doing? Weekly, we hold transparency briefings or technical briefings with officials. Major General Danny Fortin and the other officials attend to answer Canadians' questions. That's in addition to our appearance at these committees, at appearances in the House of Commons, and we will continue to be as clear and accountable to Canadians as possible. It is our commitment as a government. Thank you, Mr. Speaker.
Thank you. One other question. Has anyone else published weekly or quarterly schedules for delivery?
The answer is no. To my knowledge, we are the only country publishing delivery schedules. And therefore, I think the implication that we are not being transparent is incorrect. We are providing as much information regarding deliveries that we get. As soon as I heard that the Pfizer plant was undergoing a ramp up and had to involve reduced deliveries to Canada, I came before Canadians. I received the information on a Thursday night, and I was before Canadians on Friday morning. That's my commitment, to provide information to Canadians as soon as I get it. And it's our commitment as a government to provide that information to provinces and territories. The contracts do not contain delivery schedules on a week-to-week basis, and they therefore are not the main item that Canadians think they are. Thank you.
Thank you. Mr. Chair, how much time do I have?
You have 10 seconds.
Okay, Minister, in addition to the vaccines, part of your role during this pandemic is procuring PPEs.
Actually, now you're out of time. I'm sorry.
Okay, all right, thank you.
Sorry, Mr. Van Buinen. Thank you. We go now to...
Can I just have 10 seconds to respond?
Nope, it's my turn.
It is Ms. Rempel-Garner's turn. So, Minister, I would suggest you might respond at some other opportunity. Ms. Rempel-Garner, please go ahead, 5 minutes.
The minister said that she's releasing the delivery schedules as soon as they get them. So I'm assuming that they've negotiated quarterly delivery timelines, but they don't actually know how many we're getting from week to week. That's what she meant by that comment.
Is there a question there?
I think it was pretty clear. Anyway, I won't litigate that. Has the government directly asked the Biden administration to allow Canada to receive doses from Pfizer and Moderna's U.S. plants?
I had a call with Jeffrey Zients of the U.S. Biden administration and raised a number of options with him.
Did we get turned down?
All doses that are being produced in the United States are for the United States citizens at the current time. I raised potential timelines with the Biden administration and will continue to follow up with them to see if that is a possibility for Canada.
So we asked, but we got turned down for the near future.
This was in the first week of the Biden administration coming into being. And so at the current time, we are still having this conversation.
Okay.
I wouldn't classify it as a turn down.
So when do you think that they'll allow us to get doses from their plants?
As I said, as that Biden administration is coming into play and continuing to evaluate their situation, they are having conversations with us and other international partners to see what is possible. But all doses at the current time have been told to us that they're staying in the United States, which is why we made sure to have doses coming out of Europe,
do you
which
think
we've been
there's
able to get out.
So there's no hope for Q1 for us to get U.S. doses then? Would that be accurate?
We continue to scour the globe for doses, including in the United States and around the world.
On that note, has the minister or the prime minister phoned Prime Minister Modi to ask if we could get vaccines from India?
Well, thank you for that question. I am in regular communication with organizations and countries around the world to secure doses of additional vaccines. Thank you.
Have we phoned Prime Minister Modi?
I personally have not phoned Prime Minister Modi, and I can't speak for anyone else in our government. Thank you.
Does the minister know if the Prime Minister has reached out to the Indian government?
I do not know. Thank you.
She doesn't know. That's frightening. Has the Minister of Health asked for advice from the Chief of Defense or asked for a plan to be developed to direct the military to set up military-run vaccine distribution centers?
Sorry, you might not have heard me. No, I haven't spoken directly with the Chief of Defense. As I mentioned earlier in my statement, and frequently, that the organization of vaccination in Canada is being coordinated through the National Operations Center and Major General Tammy Fortin.
Can the Minister of Health table with committee prior to this portion of the study being completed any work that the government has done to ascertain the percentage of Canadians that need to be vaccinated prior to herd immunity being achieved?
Perhaps I can turn to Dr. Tam to talk about the work that's being done to evaluate the effect of vaccination on onward transmission.
I've only got a minute left, so I was just wondering if you could just table that with any work that's been completed with the committee.
I would like to be able to answer the question, Mr. Chair, and we do have the Chief Public Health Officer who's working with a variety of experts around the country and world on vaccination.
I would just like to know if we could have that report or that work tabled with committee, because it's not going to be answered in a minute.
Ms. Wempel-Garner, please let the witness answer.
I just want to know if that can be tabled with committee.
Thank you, Ms. Wempel-Garner.
Point of order, Mr. Chair. We all want to, witnesses has the floor. We all want to hear from them.
We can certainly endeavor to provide a variety of different research, global research on vaccination, what we understand so far.
I want to know, does the minister have any idea what the percentage of Canadians need to be before herd immunity is achieved in Canada? Like, do they have a benchmark that they're working with right now at all?
Obviously, the more people that are vaccinated in Canada, the more lives that are saved.
What's
the vaccination
percentage
right now
for herd immunity in Canada?
The honorable member is not, Mr. Chair, allowing me to answer a complex question in a way that I think would help elucidate the information she's looking for. Certainly would be happy to turn to Dr. Tam to talk about the emerging research around vaccination and its impact on onward transmission.
I'd just love that report to be tabled with committee so that we can peruse it.
Thank you. Ms. Hajdu, Minister Hajdu, if you wish to finish your answer, please go ahead.
I'm not sure of the procedure, Mr. Chair, but I would like to turn to Dr. Tam to speak a little bit about vaccination and immunity and why the answer is not clear yet worldwide.
Go ahead, please.
Well, the bottom line is that the data on vaccine effectiveness against asymptomatic infection or transmission is not yet available. There's some very limited information, so we're still gathering that. So it will not be prudent to guess at that estimate, although mathematical modelers have tried. But that is, will be published, I hope, in peer-reviewed journals.
Thank you, Dr. Tam. I would like to remind all members that according to the Bosc and Gagnon House of Commons Procedure and Practice, page 1079, that appropriate courtesy and fairness should be displayed when questioning witnesses. So thank you. We go now to Ms. Sidhu. Ms. Sidhu, please go ahead, 5 minutes.
Thank you, Mr. Chair. Before I begin, I need to highlight one important point for all of Canadians. The minister and the officials are working hard to fight this battle against the pandemic, but they represent hundreds, if not thousands, of public servants, military personnel, and volunteers. I hope I speak on behalf of all members to thanking all these public servants. So my first question is for Major General Fortin. My community of Brampton has been hit hard by the pandemic, and it was one of the earliest to receive the vaccine, one of the very few to get it before Christmas, but also one of many across the country. General, can you tell us what has been learned from the logistics of these early deliveries and the dry runs?
Mr. Chair, thank you very much for the question. I can summarize quickly that we have learned a great deal about some of the intricacies of shipping at scale, hundreds of packages across the country of a vaccine that is highly sought after. So we have seen some discrepancies in tracking numbers and addresses, so errors that are easily fixable, and we have addressed those with the provinces and territories. We've also identified some risk associated to shipping packages in remote and isolated areas, as well as into the north in the winter, with the complexities that the distributions can present in terms of air travel, road travel, as well as over the water travel. So there's a number of small lessons that are captured, are being addressed in the distribution, particularly as we scale up in the month of April onwards.
Next question to Dr. Tam. Dr. Tam, a case of South African variant has been discovered in Peel region. What do we know about the ability of the major vaccines to protect Canadians against the new variant?
Thank you for that question. And research is ongoing, but based on what is available right now, because we have been very fortunate in having 2 vaccines authorized in Canada that had a very high vaccine efficacy of over 90%, so 94, 95% in clinical trials. I think what we expect based on the data is that it has good coverage for the B117 variant originally reported from the United Kingdom. It seems to have a reduced vaccine effectiveness against the B531 variant that originally was reported from South Africa. But even with that, because they were so effective to start off with, even if there's some reduction, it is expected that the vaccines will still be providing a good level of protection, but it is still something that we continuously evaluate.
Thank you, Dr. Tam. Next question to Minister Anand. My question for you, Canada is among 14 countries in the entire world that has managed to administer over 1 million doses of the vaccine up until now. Canada negotiated the highest number of vaccine doses per capita in the world in a highly competitive market. Minister, can you describe how competitive this market is?
I actually really appreciate the question because people often say that we have this large portfolio with the highest number of doses per capita in the world. But to get to that point, we had to work extremely hard in a very short amount of time over the month of August and part of September. We had to put in place 7 bilateral agreements after receiving the advice of the Vaccine Task Force and the Public Health Agency of Canada. That required us to negotiate very quickly so that we were first in line with Pfizer, so that we were close to the first in line with Moderna. We had to move quickly. And so that product, that result with 7 bilateral agreements, 400 million doses under contract was extremely hard to do. That was after having procured 2 billion items of PPE for Canadians and 40 million rapid tests. I am so grateful to the public service and particularly the officials at the Department of Public Services and Procurement Canada for their incredible work on this file. Thank you.
Thank you, Minister Anand. Mr. Chair, do I have more time?
Not really, 12 seconds. So
pass it on.
Thank you, Mr. Liu. Nous allons maintenant, Monsieur.
We'll now hand the floor over to Mr. Thériault once again. Mr. Thériault, 2.5 minutes, please. The floor is yours. Thank you, Mr. Chair. 2.5 minutes. I heard you right this time. Major General Fortin. In response to my colleague from Lac-Saint-Jean's question regarding the drop in Moderna deliveries, you stated that you were not aware of the reason for that delay. Is that correct?
Manufacturier.
Yes, thank you, Mr. Chair. The Moderna manufacturer did not, in fact, indicate in any way what the problems were along the supply chain, but simply said they had to adapt to global demand and production challenges that they did not share with us. It doesn't seem to have an impact or any bearing on them being able to meet their obligations in terms of future deliveries. Question, you don't know the specific reason as to why there was a drop in deliveries? Response, Mr. Chairman, we do not know that why, but we are in constant deliberations with them. Thank you. Minister Anand, are you aware of what reason there might be for the drop in Moderna deliveries? Because you're in daily contact with them, and of course you have to make sure that the contractual clauses are being upheld. Are you aware of the reason for the delay? Or the drop, rather.
Say that I am in constant contact with the suppliers. As soon as I heard that there was going to be a delay in deliveries, I wouldn't say reduction because we are going to meet our 2 million target at the end of the quarter. I immediately told the Canadian public the reason that I understand has to do with the production facility in Europe being revamped, but that is continuing to ensure that we are able to meet our target.
Are you referring to Pfizer or Moderna? Are you referring to Moderna? That's what I was after.
I understand that. Yes, I believe the reason relates to their production facility, but that is something that I'm still working on ascertaining the precise details about.
Well, it's a crucial piece of information. We were talked about predictability before. In Quebec, at this current juncture, had scheduled vaccinations for seniors in seniors' residence, which still hasn't occurred. Each and every day of delay involves risks and also ramifications in terms of policies, harder lockdowns, patients who have COVID, and so on and so forth. Because, of course, the hospitals shouldn't be always overwhelmed and in a critical state. So it's important to get to the bottom of these reasons, don't you think?
The bottom of these reasons is that we received 180,000 Moderna doses this week, and we will continue to receive Moderna doses over the course of the quarter. My own father is 90 years old. I understand the urgency, and I am working every single day to make sure that we get doses into this country as we're entitled to under contract, so that long-term care, so that Canadians can have vaccinations as soon as possible. That is the clarity that I wanted to provide to you today. Thank you.
Thank you. Merci, Monsieur Theriault. We go now to Mr. Davies. Mr. Davies, 2.5 minutes, please.
Minister Anand, we heard Minister Hajdu say that transparency is very important to your government, and you mentioned that the EU asked AstraZeneca if they could disclose part of the contract. Sorry, I can't hear you, Mr. Chair.
Sorry, I was going to tell you that you've gone on mute, but I guess I went on mute. But you've gone on mute. Please ask your question one more time, and we'll continue the clock once your question is asked.
Thank you, Mr. Chair. Ms. Anand, we heard Ms. Hajdu say that transparency was fundamental to your government's approach, and you mentioned that the EU asked AstraZeneca if they would agree to disclose part of their contract, which they did, however redacted. To honor transparency, will you ask AstraZeneca if they will allow you to release part of the contract to the Canadian public?
Thank you for the question. Indeed, this is an issue that I've already raised with the vaccine suppliers. The contents of the contract, what is permitted to be disclosed, what is not permitted to be disclosed. I believe in transparency and accountability. I also believe in respecting contracts. So I am working to try to find whether there is a solution here. But at the current time, I'm obliged to observe those confidentiality provisions. I will say that AstraZeneca contract was heavily redacted, and that's an important point to remember.
I have very limited time, Minister.
Sure.
Will you disclose the confidentiality clauses themselves?
That's a very good question, and I will take that back to determine whether that would be possible within the confines of the legal parameters of the agreements.
Thank you, Minister. Minister, Deputy Prime Minister Freeland has claimed that drawing vaccine doses from COVAX was always part of the federal government's procurement strategy. However, Gavi, which is the organization leading procurement and delivery for COVAX, has noted that for self-financing countries like Canada, quote, the facility serves as a critical insurance policy that will significantly increase their chances of securing vaccines if their own bilateral deals fail. Is the Government of Canada's decision to draw from the COVAX program an admission that our bilateral deals have failed?
Not at all. Not in the least. We wanted to make sure that we were supporting developing countries. And at the same time, the way in which the COVAX facility worked was that it had two pillars, the advanced market commitment for low-income countries and the facility for self-financing countries. We invested $220 million in both pillars. We just accepted the AstraZeneca doses that were dedicated to Canada according to an equitable allocation mechanisms. And in fact, other developed countries like New Zealand are also accepting doses as well.
Mm-hmm. So help me understand. Oh, I'm sorry, Mr. Chair.
Mr. Davies. Thank you, Mr. Davies. We go now to, we start our round 3 now. We'll start with Mr. Barlow. Mr. Barlow, please go ahead, 5 minutes.
Thanks, Mr. Chair. Does the minister expect restrictions to be lifted once we hit herd immunity?
Well, thank you. And through the chair, restrictions that's a general term. There are a number of public health measures in place that are imposed by municipalities, provinces, and indeed the federal government. Certainly, as we see a decrease in COVID-19 circulating, I would anticipate that measures will be alleviated.
So when do you expect, Minister, that Canadians will be able to get back to normal life if it's contingent on whether or not the government is able to get enough vaccines as you've promised by September?
I'm reluctant to predict what a normal life or when that might happen is all about at this point. I think what we know is that provinces and territories have been steadily increasing their capacity to test, to contact trace, to do the isolation. They've learned a lot about infection and prevention control. We've invested millions, if not billions, of dollars into a variety of different supports, including long-term care homes, and we're continuing to purchase and procure vaccines for Canadians. So I think
thank you, Minister. But you've said that you will have enough vaccines that every Canadian who wants a vaccination will be vaccinated in September. So with that promise on the table, do you expect Canadians will, businesses will be back open, travel restrictions will be lifted, schools will be open, those types of things? Would life be back to what Canadians expect if you reach your promise of vaccinations by September? Will we see Canadians, will I be able to play hockey next September?
Certainly, the more Canadians that are vaccinated, the safer Canadians will be. And I would anticipate, and I certainly would turn to Dr. Tam and others, but I would anticipate that the resumption of what we call normal life will begin. I think the question of international travel is an interesting one, though, and it is why it draws attention to the importance of contributing to COVAX, because, of course, we know that many other countries will not have access to vaccination.
Thanks, Minister. I wasn't asking about international travel. I was asking about Canadians' life being back to normal. And Minister, I think this is a question you should be able to answer, yes or no. Canadians want to know this information, and all of you have talked about today about being open and transparent. Will Canadians' life be back to normal once we reach herd immunity, yes or no?
Well, I think there's a lot packed into that question. Certainly, that's the goal of vaccinating as broadly as possible, and certainly with an aggressive goal of the end of September for any Canadian that wishes to be vaccinated. I think we'll see a great return to normal, but it's difficult to predict, of course, because the virus has always got a surprise for us. So I will just say that that is indeed the goal of vaccination, that we can resume quote unquote normal life to the degree that it is possible within Canada. I think the issue of international travel is one that's under close examination.
Again, Minister, I'm not asking you about international travel. I appreciate that.
I would just say that many Canadians are looking forward to taking a vacation, clearly.
I'm sure they are. But would you expect, Minister, that lockdowns would be eased before September if we have access to the vaccines once a significant portion of Canadians have been vaccinated?
It's very difficult for me to determine what decisions provinces and territories will take. It will depend on the circulation of the virus. And as Dr. Tam's already indicated, we know a lot about the virus protecting people from death and from adverse outcomes with infection from COVID-19. What we don't know yet is how it affects asymptomatic transmission. And I'm, again, repeating what Dr. Tam has advised the committee earlier.
So with the delays we're experiencing in vaccine shipments, not only mean that more Canadians are going to be dying from preventable deaths, but also businesses that all of us are hearing from will continue to be closed, and Canadians won't be able to make their rent and put food on the table because of the measures that remain in place. So what you're saying is you expect the lockdowns to continue until
Mr. Barlow, please don't say what you think you've heard me say. What I'm saying is, of course, we're working.
You're not answering the question.
Well, you still don't have the right to tell this committee what you think I've heard, what you've heard me say. I will
then
tell
answer
you
the
that
question,
not
Minister.
what I said.
Then answer the questions.
I did answer the question, Mr. Barlow, and the answer is, of course, we're working as quickly as possible to vaccinate as many Canadians as possible, because we know that vaccination is an important tool to ending the destruction that COVID-19 has wreaked on Canadians' lives, and we are solely focused on that. But I will also say that many of the public health measures that you refer to are imposed by provinces and territories, and it is at their full discretion when and how they lift them.
Thank you, Mr. Barlow. We go now to Mr. Fisher. Mr. Fisher, please go ahead, 5 minutes.
Thank you very much, Mr. Chair. And I want to thank our witnesses and thank the government officials for being here. I know that we're not hearing an awful lot from them, but I do want to thank them for the work that they are doing day and night to keep Canadians safe. My question is for Minister Anand. Under previous governments, Canada lost the manufacturing capability and technology to produce some of these extremely highly technical vaccines. And I think this is just obviously one of the reasons why it's so important that you, Minister, and our government have worked so hard to make sure that Canada has a very strong, and I know we've heard this a lot, and diverse vaccine portfolio. So we hear that a lot. Per capita, we've got the most units per capita in the world. And I recognize that, members opposite like to say that this portfolio doesn't necessarily matter, that Canadians won't be vaccinated until 2022 or 2030, but we know that it does matter. This type of misinformation only serves to mislead Canadians and spread fear. As soon as Health Canada approved the first vaccine candidate, we took delivery of vaccines. The same with the second. And we've already delivered more than 1 million vaccines to the provinces and territories. So, Minister, I think we can agree that we're hearing a lot of false or misleading information about vaccine delivery and distribution. And I want to know if you can tell this committee what the reality is of vaccines being delivered in Canada.
Well, thank you for the question. And by all means, I would very much like to present the facts as I know them and as I present them to Canadians whenever I have an opportunity. First and foremost, you are correct that we were one of the first countries to begin inoculations in December and indeed to roll a vaccine out across this country. And the reason why we were chosen by Pfizer and Moderna for the recipient of their vaccine earlier than other countries was because that Canada was ready. The Public Health Agency of Canada, Minister Hajdu and I mentioned to the vaccine companies that we would be ready to accept delivery. And that readiness and perseverance has certainly paid off in terms of our negotiations with the vaccine companies. Moderna in particular has continued to mention that this is a temporary delay only, and they will continue to deliver. Pfizer has mentioned this is a temporary delay only, and we will, with both of those suppliers, see 6 million doses in this country prior to the end of March, as those companies are committed to do under contract. In the second quarter, we at PSBC moved very quickly to ensure that we had options under contract and accelerated deliveries so that we would see 20 million more doses of approved vaccines alone coming into this country in Q2. That is a very important fact to remember when thinking about the deliveries that Canadians should be expecting. Millions and millions of vaccines are going to be coming into this country in Q2, and Canadians and provinces and territories should realize that and be ready. And then at the end of Q3, if not sooner, we expect more than 70 million vaccines in aggregate to be in this country, and all Canadians who wish to have access to a vaccine should be. So in my opinion, the Economist's timetable, the Bloomberg timetable, the messaging that we've heard from the opposition about the impossibility of reaching these timelines is false. We have had assurances from the vaccine suppliers and indeed from approved vaccine suppliers alone, Moderna and Pfizer, that they will be shipping those vaccines to this country. And I am confident that we will be seeing Canadians who wish to be inoculated being inoculated prior to the end of September, if not sooner. Thank you for the question.
Thank you very much, Minister. And very quickly, I'd like to go to Major General Fortin. Major General, from day one, it appears that you've been giving Canadians real-time information, whether it's good news or whether it's disappointing news. And I want to thank you for that, because I don't think there's another country out there that's doing that. And I see you do that every day. And I want to know, is that a conscious decision that you made from the start, that you were going to take that information in real time and pass that along to Canadians, whether it's good news or whether it's disappointing news?
Mr. Chair, thank you very much for the question. It's an absolute honor for me to represent day in, day out a much larger team. What you see is me talking, but it's a team effort of military, public servants from across government of Canada. as well as provinces, territories, and a number of stakeholders. So it's with great pride that I share those numbers. I share numbers as we have them, as they become actionable information for partners. And if we're unsure about those numbers, we wait. But we want to provide in confidence to provinces, territories, and shareholders the truth to allow them to plan as effectively as possible. Thank you.
Thank you. Thank you, Mr. Fisher. We go now to Ms. Rempel-Garner. Please go ahead. 6 minutes, please. Sorry, 5 minutes, please.
Thank you, Chair. To the Minister of Procurement, the Globe and Mail is reporting that new Statistic Canada data suggests that we're paying significantly higher per dose than the United States and the EU for doses of vaccines, yet we're receiving them later. Is that correct?
We are paying fair value for our vaccines, and we have, as I mentioned, the confidentiality provisions, which prevent me from providing specifics relating to price. But I will say that when I say fair value, that means comparable prices to my knowledge. Of course, I don't know exactly what all other jurisdictions are paying, but we negotiated in earnest for the accelerated delivery, and we will continue to do that with the vaccine suppliers.
Well, the accelerated delivery we got was zero. So we are at the Globe and Mail is reporting $38 per dose. And that's higher than the US and the EU. Would you like to comment on that?
I sure would. Thank you for the question. It's actually incorrect for us to be talking about one price per dose. We have 7 agreements with vaccine candidates, and therefore the price per dose differs per vaccine. And I don't think it's accurate simply
accurate for Pfizer?
Throw out global numbers like that.
Is it accurate for the Globe and Mail to suggest, and Statistics Canada to suggest that?
I will say that, as I have mentioned, there is a confidentiality clause in our agreements, and I personally would be in violation of those clauses if I mentioned the price.
Got it.
Thank you.
I'd like to go back to the Minister of Health. She started responding to one of my colleagues' questions about the subject of international travel restrictions, and she raised the issue of COVID or COVAX. Is the minister looking at international travel restrictions as it applies to global herd immunity or domestic herd immunity?
Well, thank you for the question. Those considerations are very live and active right now globally. As you know, countries are struggling with decisions about what to do to restore international travel safely, and Canada is a participant in those conversations.
So would the minister be advising lifting of those restrictions upon domestic herd immunity or global herd immunity being achieved?
So I would not be advising, actually, at this point. I'm taking advice from research and science, and that research and science is underway, and it is a complex space, I will say. I, have had regular ongoing biweekly conversations with my G7 counterparts, and this is something that all countries are examining in terms of next steps on international travel.
Is the minister going to be advising any exemptions for quarantine requirements on international travelers for any groups, such as those traveling abroad for medical surgery, family reunification, minors under 18, or religious missionary travel?
You know, Canada has some of the strongest measures at the border in the world, including a mandatory 14-day quarantine. It's been a very important.
Sure, and we all support that. I'm just for the new hotel quarantine restrictions. Is she looking at any exemptions for any particular group, including temporary foreign workers for agricultural workers?
We're working out the details right now in terms of how we'll manage the mandatory 3-day quarantine. All that to say that quarantine is an important component of our commitment to reducing importation at the border and to understanding the role of variants in a Canadian context.
So there's no exemptions that will be put in place for the first round under a potential OIC?
That is not what I said. I said that we are carefully examining those groups of travelers and how we best manage them.
When does the minister expect those rules to be put forward to the Canadian public?
We'll be releasing the details of those new measures very shortly. And I also want to take this opportunity to thank the Canadian Hotel Association, who's working very closely with us on the plan.
Does very shortly mean within the next week?
Very shortly.
5 days, 10 days?
Very shortly.
Does the minister want to comment on any work that she's undertaken with the finance department to tie herd immunity to potential figures for long-term sustainability of the CERB?
No, I'm not sure what the question is.
The question is, have you talked to the finance department about your assumptions on herd immunity and how long we'll need the CERB?
The finance minister and I have regular conversations about the supports that are necessary to help Canadians get through this difficult time and do whatever it takes to make sure that we reduce the spread of COVID-19 and restore the functioning of our economy.
Thank you, Ms. Rempel-Garner. We go now to Dr. Pawlowski. Dr. Pawlowski, please go ahead, 5 minutes.
Prime Minister has repeatedly said that every Canadian that wants to have a vaccine will have one before September. My understanding is that's based solely on existing contracts we have with Moderna and Pfizer. However, there are 3 other vaccines which are currently waiting for approval in Canada. 2 of those have completed phase 3 trials and shown effectiveness. Although AstraZeneca and Johnson & Johnson might not have in the original trials shown 95% efficacy, like Moderna and Pfizer, they weren't head-to-head trials with those other vaccines. It was a different population, different amounts of variants. In addition, it seems with further boosters, you can increase the efficacy of pretty well all vaccines. Johnson & Johnson only has one. Their result was with 1 shot. In addition, although Johnson & Johnson was only effective in preventing 70% of people getting COVID, it decreased the number of admissions to hospital and deaths 100%. So these vaccines seem to me to be very, very likely to be approved. The results of these studies are public and have been much scrutinized by the medical community. I know we have to wait for completion of the regulatory process, but it seems to me Johnson & Johnson, AstraZeneca are very, very likely to be approved. AstraZeneca has already been approved in some jurisdictions. And if preliminary results from Novavax hold, then we have a 5th vaccine. I understand our reluctance to count our chickens before they hatch. However, again, it seems very likely that probably all 3 of these vaccines will be approved. Canada's bought millions of doses of these vaccines. So given this, it would seem to me our promise to have every Canadian who wants to be vaccinated before September is very conservative in a sense of a prediction, not in a sense of the party. I know we don't want to rightly make promises we can't keep, but there's a great deal of COVID fatigue out there, and that's resulted in real health problems. People are unhappy, they're despondent, they're drinking too much, they're overdosing, they're ignoring public health advice because they don't see an end in sight. So I would assume that our government has some prediction on vaccination rates and timelines if the other vaccines are approved. Would you be willing to share this with us? So my question is to anyone who might want to answer that question. I don't think we should promise anybody anything, but I think Canadians really want hope, and I think that's from what I'm hearing, that September timeline seems very conservative.
Well, I'll start, and then maybe I can turn to Minister Anand to speak a bit as well. You're right. It's a difficult time right now for Canadians, and they are anxious and tired of the restrictions in which they've faced, a new reality. But I do want to take the time to actually thank Canadians, because by and large, Canadians have followed the public health measures, and it has been difficult. And there are sacrifices, some that we see in the media and some that we'll never know about, that people are making in their daily lives to protect each other. And I truly am proud to be a Canadian when I look at my fellow Canadians and the amount of astronomical work they're putting into life in their community, protecting each other, sustaining and adapting their businesses. The stories go on. The target that we've repeated, which is our goal of having enough vaccinations in the country for every Canadian that wishes to be vaccinated by the end of September, I think is a realistic target. But it doesn't mean that there's not a lot of work ahead. As I think Minister Anand has pointed out and many others, we start to see the volume of vaccines arrive in this country. All things considered, with manufacturers hopefully getting all of their ducks in a row. But the commitment is that we'll have those doses in Canada in increasing numbers over the next 2 quarters. So what that means is, April, May, June, very, very busy for Canadians and for provinces and territories. July, August, September, still very, very busy. And provinces and territories are stepping up. You've heard Major General Denny Fortin speak about the work that the provinces are doing right now to not only make sure they have the capacity to vaccinate in large volumes, but to tap into some of the networks that actually help them every single year in massive influenza vaccination campaigns, for example. So I think Canadians can be confident that the vaccines are coming. If we manage to exceed that target of the end of September for every Canadian that wishes a vaccine to have one, that's great news for Canada. But again, sticking with trying to remain realistic in these targets, I think it's a reasonable goal. And I'll turn to Minister Anand if she has any other words.
Go ahead, Minister.
Thank you so much. And I just want to add that there are 2 variables that can see the acceleration of doses from Q3 to Q2, which is something we're working very hard on. The first is that we are working with approved suppliers to see if they would be willing to move doses from Q3 to Q2. We've had some success on that already, which I have announced previously, but we're still working to make sure that approved suppliers and inquire with them to see if their doses can be moved earlier into Q2. That would be useful in terms of accelerating our timelines. The second variable, of course, is the speed at which additional approvals occur at the separate regulatory body of Health Canada. And as we see additional vaccines come online, we will hopefully see accelerated deliveries of those vaccines, and our numbers previously provided in chart form and repeated here a number of times also accelerating. So as you can see, this is an environment with many moving parts where suppliers are ramping up production at the same time that regulatory bodies are approving new vaccines. And it's very important for us to be aware that the targets that we are setting are realistic. They can change. And as soon as we have information relating to additional deliveries to be expected in Q2, we will share that with the Canadian public. It's my commitment. It's our government's commitment. Thank you.
Thank you, Dr. Pawlowski. We go now to nous allons maintenant, Monsieur Thériault.
Mr. Thériault, once again. Mr. Thériault, you have 2.5 minutes. Thank you, Mr. Chair. Now, listening to the responses to the questions asked about supply and procurement, it's as if we had to get down on bended knee to these pharmaceutical companies. But someday ahead of us, I'm sure we'll have light shed on this issue. The Health Minister will surely agree with me to the extent that each and every day that goes by, each and every day that there are extended delays to the vaccination process and its rollout, that this will put increasing pressure on our healthcare network, on our healthcare workers, on our frontline workers, and will increase the number of non-COVID patients because, of course, they're sitting on the sidelines waiting right now. They're the ones who are being triaged out. Why are there so many non-COVID patients? And that's because there's been chronic underfunding over decades of the healthcare network. We're not able to deal with the pandemic with the means that we should have at our disposal. Now, Is the government's stubbornness in this regard, because apparently the government cooperates very well with the provinces and territories, why don't they just simply increase the healthcare transfers to the provinces and territories? This would send a clear signal as far as the hardship that they're experiencing. Why not set aside those resources? Why not earmark that money? Because it smacks more of a power trip than it does a logical approach to a public health crisis.
Merci pour la question.
Thank you for the question. The government at all levels is cooperating to ensure Canadians' safety. And in our COVID-19 report, we announced the Safe Recovery Plan rollout for $19 billion for the provinces. But, Madam Minister, that's the same old record there, tired old record. Why doesn't the federal government increase transfer payments to the provinces and territories right now so that they can look after Canadians and Quebecers? There are so many patients, non-COVID patients, that can't get treatment. Why not send a clear signal to our healthcare providers? That's my question.
Vous êtes sur mute.
You're on mute.
Please go ahead and answer.
Well, since day one of this crisis, we have transferred envelopes of money to the provinces and territories to help them with their healthcare services and their networks. We're going to be there to stand up and protect Canadians, and I'm sure that you're fully aware of that, sir.
Merci, Monsieur Thériault.
Mr. Thériault.
We'll go now to Mr. Davies. Mr. Davies, please go ahead. 2.5 minutes.
Thank you, Minister Anand. The government has said repeatedly that we have enough vaccines from Pfizer and Moderna locked in now alone to vaccinate every Canadian by September. We also have, as one of our 7 contracts, one with, I think it's 20 million doses from AstraZeneca. If that's true, why then did Canada need to access 2 million doses of AstraZeneca vaccine from COVAX, which, let's face it, is a fund primarily to help low-income countries get access to the vaccine?
Well, thank you for the question. As I said, we are aware and participate in COVAX and its 2 pillars. The multilateral procurement pooled mechanism is for the purposes of receiving doses in both developed and developing countries.
Right, but my question, Minister, is why access that? If it is true that you already have enough from Pfizer and Moderna, you don't need to access COVAX.
But Mr. Davies, the reason is that we would like to have as many doses in Canada as early as possible, and COVAX allows us earlier doses, and that was our goal in selecting AstraZeneca.
Well, this is what Diana Sarosi from Oxfam says. She says Canada should not be taking the COVAX vaccine from poor nations to alleviate political pressures at home. Receiving 1 or 2 million doses isn't going to solve Canada's vaccination challenges, and it is going to cause harm elsewhere in the world for the poorest and most marginalized people. How do you respond to that statement?
I respond by saying that we are committed to COVAX. We provided $220 million to the advanced market commitment, which is for low-income countries specifically. We are making sure that we participate not only through the advanced market commitment for low-income countries, but also in the governance of COVAX with Karina Gould, our Minister of International Development, making sure she's taking a leading role on behalf of our government. And in addition, we will share excess doses with the rest of the world once those doses come into Canada and are not usable.
Okay.
So there is the intention to help the rest of the world.
Sure. My final question is this, obviously we're in a global competition for limited supply. We have billions of people chasing millions of vaccines. India and South Africa have proposed to the WTO to loosen trade rules to allow all countries to have access to intellectual property instead of having a handful of companies control limited supply. Why is Canada opposing that proposal at the WTO?
Actually, I appreciate the question, and I am not sure of the reason myself. I am so focused on procuring vaccines for this country. I spend every waking moment, and there aren't many others in the day on this issue, but I will certainly get back to the member about this question and elucidate it for both him and me.
Thank you, Mr. Davies.
Thank you, Minister.
So that brings our questioning to a close. I'd like to thank the
Mr. Chair, can I just have a point of order, Mr. Chair?
Go ahead on your point of order.
Thank you very much, Mr. Chair. I just want to suggest we did start 5 minutes late because we were waiting for some witnesses, and we do have 5 minutes. I'm wondering if we have a quick 1 or 2 minute round for each party just to make up for that lost time, and we still have 5 minutes left in our allotted committee time. I'd like to make that proposal.
It's a reasonable request. However, I have been informed by the clerk that we have a hard stop at 4 o'clock. We had planned to do some committee business following the presence of the testimony of the witnesses, and unfortunately, that's not going to be able to be
Chair,
done.
it's not.
We're going
point of order,
to.
It's not 4 o'clock yet. There's 5 minutes till 4.
Excuse me, please do not interrupt me. So that's not really going to be able to be done. There's really no time. We have 5 minutes
left till 4.
Pardon me, Ms. Rempel-Garner. I would appreciate if you do not interrupt me.
Point of order, Chair.
I will deal with your point of order when in due course. So that's what I wanted to inform the committee, that that we will not be able to do the committee business we proposed at this in this meeting, but we will be able to take it up. I'll consider it deferred until the next meeting, following witnesses after the next meeting. So I take your point that there is, there's 4 minutes left. If everyone wants to have each party wants to have a 1 minute round, I'll certainly go ahead with that. So Ms. Rempel-Garner, who would you like to speak on your end for 1 minute? Go ahead, Mr. Barlow, 1 minute.
Thank you very much, Mr. Chair. And I'd like to put a motion on notice. We know other countries like the United States have negotiated weekly vaccine commitments into their contracts with suppliers and penalty clauses when those allocations aren't met. We've certainly heard today that we do not have the same mechanisms within the contracts that we have signed. We're told Canada's managed not weekly, not monthly, but quarterly commitments, which I think is very concerning, and there's no recourse when those allocations aren't met. Of course, none of this can be verified, not by journalists or premiers or elected MPs, and I think this needs to change, Mr. Chair, and our job is to get answers for Canadians. Now, we know the law clerk to date has received more than 6,000 documents from the government in response to our
Please
House
wrap
order.
up the question. You've got 20 seconds left.
So, Mr. Chair, I'd like to table the following motion: that the chair of the committee write the law clerk and parliamentary council inquiring whether or not the contracts for Canada's 7 vaccine agreements with suppliers have been provided to his office as part of the motion adopted on October 26, 2020 by the House of Commons. Should the law clerk have copies of these documents, the committee instruct the law clerk to prioritize the translation of these documents, and these documents be published as soon as possible in accordance to the parameters set out in the House motion. If the law clerk does not have these documents, the committee requests from the government the contracts for Canada's 7 vaccine agreements with suppliers be tabled with the committee and the documents be vetted in accordance with the parameters set out in the House motion, and the members of the Standing Committee on Health review these documents in camera.
Thank you, Mr. Barlow.
Mr. Chair, could I just respond to the motion?
My time is up, Mr. Chair.
Yes, I'm going to rule the motion out of order this time, as Mr. Barlow knows.
It was tabling of a motion. Point of order.
It was tabling a motion, Mr. Chair.
So we will have to debate.
We do not have time to deal with this at this time. We've got 2 minutes left. We have technical issues with the room. We have the technical staff. They've given us a hard stop.
Point of
order, Chair. I was just tabling the motion, Mr. Chair, not up for debate. I wasn't moving the motion. I just tabled the motion.
He was giving notice of motion.
Okay, I'll accept as a notice of motion. And unfortunately, we now have only 2 minutes left. We're going to have to go over by a couple of minutes to allow the other parties their 1 minute. So I believe it's Dr. Pawlowski for the Liberals. Please go ahead. 1 minute.
a lot of Canadians are genuinely concerned about the possibility of having to deal with the South African variant. My understanding of the way the vaccine works is that it's going to be fairly easy to adapt the current vaccines in order for them to be effective against the South African variant. Some companies, like I think both Moderna and Novavax, are already in the process of doing that and testing these tweaks. With these tweaks, will the vaccines have to go through the whole regulatory process again, i.e. phase 1, phase 2, phase 3 trials, and be approved, or will it be quicker?
That probably is a good question for Deputy Lucas or Dr. Tam.
I would say Health Canada is working with the vaccine suppliers, in this case of the 2 approved vaccines, Pfizer and Moderna, to have them look at the impact of the variants and any considerations on change in design that could result in, for example, a booster shot, and that research and regulatory requirement work continues.
Thank you, Dr. Pawlowski. We'll go now to Monsieur Thériault. Une minute, s'il vous plaît.
Mr. Thériault, 1 minute, please. Mr. Chair, I'd like to draw the Health Minister's attention to the fact that the collateral effects of the pandemic are going to go far beyond her realistic vaccination rollout schedule. And currently, Quebec and the provinces are trying to plan their budgets. They are subjected to huge pressures. There's huge pressure on healthcare workers, on their ability to organise and plan for healthcare. And it strikes me as absolutely paramount and urgent that healthcare transfers be increased immediately and not do what the Prime Minister has suggested, to wait till after the pandemic, as if we had the luxury to do so. You know, we've got to face the facts right now. The bottom line is Quebec and the provinces need more money to deal with their healthcare needs. It strikes me as logical and straightforward when it comes to public health.
Madame Ministre.
Every step of the way, Monsieur Thériault, we've been there for Quebecers. And indeed, we have paid for the full price of PPE, of expertise, of long-term care supports, of infection prevention control expertise, of the vaccines, the $19 billion for a safe restart, the CERB money for Canadians who are unemployed, the small and medium-sized business supports, the wage subsidies. Mr. Speaker, Mr. Chair, through you, we have been there for Quebec and will continue to be there. The Prime Minister has indicated that he will support.
Madame la...
Predictability, Minister. Predictability, Minister. These provinces and territories are putting together their budgets. They need to make plans. We need to rebuild our healthcare networks. Predictability. Your time has run out, Mr. Thériault. Your time has run out, Mr. Thériault.
Go now to Mr. Davies. Mr. Davies, please, 1 minute.
Thank you. To Dr. Tam, Canada is set to receive 1.9 million vaccine doses by COVAX. That's a bigger allocation than dozens of other countries are going to receive, including Haiti, Mali, Nicaragua, South Sudan, Rwanda, Zimbabwe, Papua New Guinea, Namibia, the list goes on. My question as an international public health officer is, this is a globally mobile virus, and given that equitable distribution of COVID-19 vaccines is key to ending the global pandemic and preventing the emergence of vaccine-resistant variants, isn't it in Canada's interest to leave these doses for high-risk populations in low-income countries? Are we going to be unaffected by high-risk populations being unvaccinated in the world while we vaccinate low-risk people here?
I think at this point in Canada, we are still trying to cover the high-risk population. So we are in a very difficult situation right now. But no, my bottom line is that no one is protected until everyone is protected. So this is why it is important for Canada to contribute to the international vaccine supply as well.
Thank you, Mr. Davies. And thank you once again to all the ministers and all the officials for sharing your time with us today and for all of your expertise. And thank you for what you're doing on a day-to-day basis to help us work through this this pandemic. And thank you to the members, of course, for being here and asking great questions. And with that, we are adjourned.